Osteoarthritis is an orthopedic disease. Look at this picture, shows that normal knee joint and osteoarthritis knee. Look at this X-ray findings, CT findings, shows degeneration of cartilages. Then MRI findings, detail going on. Introduction. Osteoarthritis is the most common form of arthritis, affecting millions of people worldwide. It is a chronic joint condition characterized by the breakdown of joint cartilage and underlying bone, leading to pain and stiffness, primarily in the hands, knees, hips, and spine. Definition. Osteoarthritis defined as a degenerative joint disease resulting from the deterioration of cartilage, the smooth tissue at the end of the bone, which helps in smooth joint movements. The disease can affect any joint but typically affects the weight bearing joints like the knees and hips. Types. 1. Primary osteoarthritis develops as a result of aging and wear and tear on the joints. Second, secondary osteoarthritis resulting from another disease or condition such as injury, obesity, genetics, or other forms of arthritis. Causes. 1. Age. The risk increase with age. 2. Joint injury or overuse. Injuries or excessive use can damage cartilage and lead on OA. 3. Genetics. Family history can contribute to the likelihood of developing osteoarthritis. 4. Obesity. Excess weight but extra stress on weight bearing joints. 5. Muscle weakness. Weak muscles around the joints can lead to instability and increased wear on the joints. Risk factors. 1. Age. Older adults are more at risk. 2. Sex. Women are more likely to develop osteoarthritis, particularly after menopause. 3. Obesity. Excess weight contributes to the risk of osteoarthritis. 4. Joint injuries. Past joint injuries can increase the risk. 5. Genetics. Family history can increase the risk of OA. 6. Bone deformities. Congenital or developmental bone deformities can increase the risk. Complications. 1. Chronic pain. Persistent pain that affects daily activities. 2. Reduced function and disability limited movement, and inability to perform daily tasks. 3. Joint instability, increase the risk of fall and injuries. 4. Psychological effects, depression and anxiety due to chronic pain and disability. Pathophysiology. The pathophysiology of OA involves the gradual degeneration of joint cartilage and changes in the subchondral bone. It includes 1. Cartilage breakdown. Loss of cartilage leads to bone-on-bone contact, causing pain and reduce the mobility. 2. Inflammation. Although less pronounced than in other type of arthritis, mild inflammation can occur. 3. Bone changes. Formation of bone spurs and subchondral sclerosis. 4. Synovial inflammation. Mild synovitis, inflammation of the synovial membrane may occur. Signs and symptoms. 1. Pain, joint pain during or after movement. 2. Stiffness, joint stiffness, especially in the morning or after periods of inactivity. 3. Tenderness, joints may feel tender when light pressure is applied. 4. Loss of flexibility, reduced range of motion in affected joints. 5. Grating sensation, feeling or hearing a grating sensation when using the joint. 6. Bone spurs, extra bits on the bone may form around the affected joints. Diagnosis. 1. Clinical evaluation, physical examination and assessment of symptoms. 2. Imaging test, X-ray, MRI to view joint space and cartilage condition. 3. Lab test, blood test to rule out other forms of arthritis. 4. Joint fluid analysis, examination of fluid from the affected joint. Nursing diagnosis. 1. Chronic pain related to the degenerative nature of disease. 2. Impaired physical mobility due to joint pain, stiffnesses. 3. Activity intolerance related to fatigue and joint pain. 4. Self-care deficit due to decreased range of motion and pain. 5. Risk for injury related to joint instability and falls. Management and treatment. Medical management. 1. Medications, pain relievers, corticosteroids, hyaluronic acid injections. 2. Physical therapy, exercise to strengthen muscles around the joint, improve the range of motion. 3. Occupational therapy, techniques to make daily activities easier. 4. Assistive devices, braces, shoe inserts, canes. 5. Surgical options: joint replacement surgery, arthroscopy, nursing management, pain management, administer medications, provide heat cold therapy. To education, teach patients about disease process, joint protection techniques, and weight management. 3. Exercise programs. Encourage low impact exercise like swimming or walking. 4. Assertive devices. Educate about the proper use of harness, walkers, and other devices. 5. Monitor for complications. Watch for signs of increased pain, swelling, or decreased mobility. Psychosocial medicine. 1. Support groups. Encourage participation in support groups for emotional support. 2. Counseling. Provide referrals to counseling services for coping with chronic pain and disability. 3. Patient education. Educate patients about stress management techniques and coping strategies. Prevention. 1. Maintain a healthy weight, reduce stress on weight-bearing joints. 2. Stay active. Regular physical activity strengthens muscles and around joints. 3. Avoid joint injuries. Use proper techniques during activities and sports. 4. Healthy diets. Ensure adequate intake of nutrients that support joint health like omega-3 fatty acids, vitamins, and calcium. In conclusion, osteoarthritis is a prevalent and debilitating condition that significantly impacts quality of life. Through proper management, including medication, physical therapy, lifestyle changes, and surgical interventions, patients can manage symptoms and maintain a reasonable quality of life. Nursing care play a critical role in patient education, pain management, and support, helping patients to navigate the challenges of living with osteoarthritis. Thank you. Have a good day.